Good afternoon, everybody. I want to provide you with a further update on our response to the COVID-19 epidemic. First of all, I can confirm that as at 9 o'clock this morning, there have been 3,706 positive cases confirmed, which is an increase of 361 from yesterday's figures. As always, let me be clear that these numbers will be an underestimate. A total of 197 people last night were in intensive care with confirmed or suspected cases of COVID-19. That is an increase of 5 on yesterday, and a total of 1,590 patients are currently in hospital with COVID-19. That includes those in intensive care, and that is an increase of 110 since yesterday. Today, there have been 2 reported deaths of COVID-19. That takes the total number of deaths in Scotland to 220. But I want to be very clear today that this figure should not be taken as being truly representative of developments this weekend. As you will recall, on Thursday I explained that we were changing the way information on deaths is verified before being reported. The new system uses information validated by the National Registers of Scotland and is based on the registration of deaths. Work is underway this weekend to move the NRS system to a 7-day-a-week operation, and emergency legislation has changed the regulations to help registrars meet this additional need, allowing the death notification process that previously happened face-to-face to now happen electronically and over the phone. However, the NRS system is not yet fully up and running 7 days a week. As a result, the figure I have reported today and the figure I will report tomorrow is likely to be artificially low, though of course each one matters and each death is a source of sadness to family and friends and also to me. These figures will be reconciled on Tuesday and Wednesday, and I expect that they will continue to increase from the 46 deaths reported yesterday. As I set out last week, further information on deaths, including those in the community where COVID-19 is a presumed cause of death, will be published by National Registers of Scotland this week, and we will provide the media with a full briefing in the coming days on the recording and reporting of deaths so that there is a full understanding of the basis of that. I want once again to thank everyone who works in our health and care sector. Your efforts are, as always, hugely appreciated. I always include the care sector in that thank you, and of course this weekend there is a very important reason for doing so. I can confirm today that the provider of the Burlington Care Home has notified the Care Inspectorate of 16 deaths over the period 27th March to today. 12 of those were displaying symptoms consistent with COVID-19, and my thoughts are with the families of all of them. This has, of course, brought home over this weekend the fact that staff in the care sector are doing a very demanding job in very stressful circumstances, and I'm grateful to each and every one of them for the work that they do. We remain in close contact with Burlington Care Home through the Care Inspectorate about the situation there. The home currently has sufficient staff cover, and it also has adequate supplies of personal protective equipment. More broadly, we are in close contact with the Care Inspectorate to understand how COVID-19 is affecting the delivery of care across the country. The NSS Social Care Call Line, which helps care service providers with urgent equipment needs, has been running for 2 weeks. In that time, more than 6 million pieces of personal protective equipment have been delivered to more than 1,000 care homes and other locations across Scotland. Our care services, the staff and the residents of care homes are as important to us as those working in or being treated in our hospitals. And I want to give an assurance today that we will do everything we can to ensure that they always have the equipment and the treatment that they need. There are 2 other updates I want to give this afternoon. The first is that the Scottish Government is making £30 million available to local authorities so that they can help people who are struggling to get the food they need. We know that for some families, for example, those where children usually get free school meals, this pandemic is making it harder for them to feed themselves and their families. This funding is intended to help councils help them. Councils can use the funding flexibly in order to meet local needs and circumstances. For example, they'll be able to work with community groups and businesses to support home delivery, provide financial help and help people eat a balanced and healthy diet. COVID-19 is above all else a public health emergency. However, the steps we need to take to address that emergency have a range of other consequences. We're determined to take action to address those consequences and to help those most in need. The final point I want to update you on is the response to our efforts to increase health service capacity by encouraging people with the relevant qualifications to join or rejoin the workforce. I can confirm today that so far almost 10,000 people have come forward to offer to help. They include medical and nursing students, retired NHS staff, those on a career break, and healthcare workers from outside the NHS. We're looking to fast-track processes such as disclosure checks so that many of these applicants can join the workforce as soon as practical. They will play a vitally important role, either by helping to treat patients with COVID-19 or by working in other areas and therefore increasing the NHS's overall capacity. And again, I want to thank each and every one of them. Finally, I want to address an issue that the Chief Medical Officer will speak to herself shortly. The Chief Medical Officer made a mistake in travelling away from her home. Whatever her reasons for doing so, she was wrong and she knows that. It was not in line with the advice we are asking everyone to follow. She has apologised unreservedly to me and to the public, and she is right to have done so. As I said, she will address the matter herself in a moment, but I would like to say this. I've said this from this podium before, that all of us, including me, will make mistakes in these unprecedented times we're living in. When we do, we must be candid about it and learn from it. That is what I know the Chief Medical Officer is doing. In making abundantly clear that she was wrong, we will underline the reasons why we are asking everyone to comply with this advice. But what I also know is that over these past few weeks, as we have been dealing with this crisis, her advice and expertise has been invaluable to me, and it continues to be so. If I am to do what I need to do to steer the country through this crisis to the very best of my ability, I need her to be able to focus on the job that she is doing. A job that, notwithstanding her mistake on this, she is doing extremely well. So I'm not expecting you not to be angry about this mistake, and nor is she. But I am asking you to consider the wider importance to the government and by extension the country of being able to count on the continued expertise of the Chief Medical Officer at this critical time as we fight this virus. And of course, it remains the case that for all of us, the best way of showing solidarity and support is by sticking to social distancing guidelines. We all know what they are, and we are all being reminded of them today. But as the virus spreads, I want to take the opportunity today to remind people of the specific restrictions if you get ill. If you think you have coronavirus, please do not leave the house for 7 days from when you first get symptoms. And if you share a house with someone who has symptoms, you and your household should all stay at home for 14 days without going out at all, even for the essential purposes that we're advising others are permissible. By staying away from each other and by not meeting up with other households, you're doing the right thing. You are all helping to slow the spread of the infection. You're giving the NHS a chance to cope, and you are saving lives. So my thanks once again for everyone who is helping to do that. I'm now going to hand over to the Chief Medical Officer, who wants to say a few words herself, and then we will take questions from the media.
Thank you, First Minister. I've already issued a statement this morning apologising unreservedly for travelling away from my home while restrictions were in place. As well as this weekend, it's important to be clear that I also was there last weekend with my husband. I did not follow the advice I'm giving to others. I'm truly sorry for that. I've seen a lot of the comments from members of the public on Twitter today, people calling me a hypocrite, people telling me about the hardships they've endured while following my guidance. My office has also received emails from members of the public who are making clear to me their disappointment and unhappiness at what I've done. People have told me that I'm irresponsible, that I've behaved as if my advice does not apply to me. I want people to know that I have seen all of that, and I've heard the comments. What I did was wrong. I'm very sorry. It will not happen again. I know how important the advice is that I've issued. I do not want my mistake to distract from that. I don't want to make the jobs of the police or my NHS colleagues any harder, and I apologise to them as well. I have a job to do as Chief Medical Officer to provide advice to ministers on the path of this virus and to support the medical profession as they work night and day to save lives. This was a mistake, human error, and there's no excuses. I should not have done what I did. I'm very sorry about that. I've spoken to the police this morning about this, and I'm sorry for taking up their time on this when it could have been avoided. Having spoken with the First Minister this morning, my intention is to continue to focus on my job.
Thank you, Chief Medical Officer. I'm now going to go to questions. I'll take Peter Smith from ITV News.
Thank you very much, First Minister. First, I have a few questions, one for you and one for the Chief Medical Officer. The first question, First Minister, you must know how angry people are in this country today in hearing that the Chief Medical Officer has flouted the rules, not once but twice now, that people in this country are making great personal sacrifices. We are speaking to people who have had to separate their families, people who are losing their businesses over this, people who can't attend funerals because they are putting faith in the message that you and your government is putting out. What we've seen from the Chief Medical Officer is flouting these rules, and then the message that we're getting from that is that, is this a matter of life and death, or is it not? If she believes it really is a matter of life and death, why did she make the decision to break these rules not once but twice? Compounding this, we've had your National Clinical Director, Jason Leach, today defending her, saying that when she went to her holiday home, it was actually safe to do so. Her family was safe, and the people that she was around were safe because she observed social distancing. The message that the public are getting from that is that it's okay for us all to go to the beach, to our holiday homes, to our caravans, as long as we observe social distancing. That's clearly not the message your government's been putting out. Your message has been undermined. So the mixed messaging is now frankly dangerous. So my question to you, First Minister, is how can you in good faith allow the Chief Medical Officer to continue addressing the public? We have no faith in her anymore. The question to you, Chief Medical Officer, is that if you have heard how the public is sacrificing the great personal cost to many people, and you know this, you may have the confidence of the First Minister, but I would put it to you that the majority of this country has lost confidence in you over this issue, and that we need a leader, an expert that we can have confidence in. So why on earth do you believe that you can really be the public face of a message to stay home and protect the NHS and save lives?
Well, let me address that directly. Firstly, the Chief Medical Officer has said that she complied with social distancing while where she was, but that does not change the fact that she should not have been there. And I know that, she knows that, it was wrong, and there is no attempt to justify it or explain that, and I want to be categorically clear about that. We are asking people, I am asking people to make very difficult sacrifices right now, and it is important that they understand the seriousness of that. So I do understand that people are angry. The Chief Medical Officer understands that as well. I have made clear to her, and she is making clear to the public, that there is no justification for this. People make mistakes. We all wish that wasn't the case. I wish that wasn't the case. I have made mistakes of my own. What I am saying is that having apologised and all of us taking the opportunity to use this to absolutely underline again the importance and the reasons for these measures, the Chief Medical Officer has a job to do. And I can only say to the public as First Minister that I know how vital the advice and the expertise she gives to me is in the judgments I have to make about how we steer the country through. At this juncture, it is important to me that I can continue to rely on that the government can continue to rely on that, and the public can continue to rely on that. And that's why I am saying that I don't justify or condone or ask people not to be angry, but I do ask people to understand the wider importance of that as we tackle this virus. Chief Medical Officer.
Thank you, First Minister. I do not offer any justification for what I did. It was wrong. I have seen the anger that people have put quite rightly on Twitter. I have heard from some of my own NHS colleagues, and I have let not only them in the NHS down, but also the general public down. I did make a mistake. It's a fundamental mistake. I didn't follow the advice that I'm giving to others. I cannot justify it. I can only apologise, and I apologise again unreservedly.
Katrina Renton from BBC Scotland.
Thank you very much, First Minister. Just following on from that, is it tenable for the Chief Medical Officer to continue in post and front public health advice, given a number of issues? The Scottish Labour Party, the Conservatives and the Greens have said that her position is no longer, and the Liberal Democrats have said that her position is no longer credible. The Scottish Police Federation have said this morning that her actions have made the jobs effectively of ordinary officers more difficult, saying how do they address these issues with members of the public when the advice from the person that we are meant to be listening to has been flouted. We've heard from the local community council in Earlsbury who have said that this has caused huge upset to them, that they have a large, vulnerable and elderly community, and they've been trying very hard to keep the government's advice going. And of course, they have been disappointed in the Chief Medical Officer's presence there this weekend. And of course, on top of that, this issue, if it rumbles on, could become the story and not the advice that people need to be taking about coronavirus.
Well, firstly, let me say very clearly again that nobody, not I, not the Chief Medical Officer, is trying to justify in any way what she did. It was against the guidance. She recognises that and has apologised. And I think it's also important to say that she is not escaping consequences for that. The Chief Medical Officer has been spoken to this morning by the police, which is exactly the same as the police would have done in the case of anybody else who had acted in this way. And that is really important here. The fact that the Chief Medical Officer is standing here right now, facing justified criticism, answering these questions, should send a clear message that this guidance is for everyone. It is not simply for some people and not for others. And that does enable me to underline again the importance of this. I do not condone breaching of this guidance, whether it's by the Chief Medical Officer or anybody else. And I think it is important that we do take that opportunity to make that clear. I understand the views that are being expressed. I understand the anger that people will be seeing. The Chief Medical Officer is here today facing that criticism squarely and rightly so. But let me say as First Minister, and I don't say this lightly, it would be damaging to my work and to the work of the government right now in the overall picture of dealing with this crisis not to have the ongoing advice and expertise of the Chief Medical Officer. I know how vital that has been to me in steering my way through some of these difficult judgments in the last few weeks. In a previous situation, when we had the swine flu pandemic, not as serious as this, I know how important it was to me then as Health Secretary to have the advice of a Chief Medical Officer. That matters to the overall handling of this crisis. And lastly, what I would say is this, and I've made this point several times since the start of this outbreak. We will all, and that includes me, get things wrong. We will all make mistakes. I wish the Chief Medical Officer hadn't got this wrong. Believe me, I do. But we will all make mistakes, and we have to I think hear the apology, hear the recognition and understand, as I have done after careful consideration this morning, the wider imperative of ensuring that we continue to have an overall approach to this pandemic in Scotland that is guided by the best possible advice and expertise. And for me, that comes from the Chief Medical Officer. Ivana Holland, STV.
Yes, thank you, First Minister. Is there not a fear here in terms of what we're going to put the public through? Because if they follow the example of the Chief Medical Officer, then they can drive to a position where the police have told us many times that we're not allowed to do, go for a walk, socially distance in that time, go back and then just offer an apology afterwards. And then if they are spoken to by the police, there's only been a warning issued, no fine. Whereas we've had phone calls in from people specifically today telling us that they had fines issued on them for sitting in their cars. So I wonder, where is the fairness in the treatment? Is it really a case of double standards?
Well, obviously, I am not able to speak for the police. The police enforce this guidance as they should do and have spoken to the Chief Medical Officer this morning as they were right to do. If the Chief Medical Officer was to repeat her mistake, then it would not be simply being spoken to. Further action would follow. And it's right. And what I'm saying very clearly here today is that it is not a case of one rule for some and another rule for others. So people should not follow the lead in this respect. The Chief Medical Officer herself is saying that she got it wrong. She absolutely got it wrong. She did not follow the advice we're giving everybody, and that is the important point to underline. This advice has not been given for no reason. This advice is being given for the best of reasons. It is about protecting life and protecting the health service. So when people flout it, whether that's the Chief Medical Officer or any other citizen of our country, it is right that it is made abundantly clear that that is not acceptable, and that's what is happening now as well. Dominic Waghorn from Sky.
Thank you very much, First Minister. You've obviously been working closely with the Chief Medical Officer and spending a lot of time with her. Did she honestly not tell you where she was spending her weekends 2 weeks in a row? And to the Chief Medical Officer, can I ask you honestly, do you think you can do your job as well or better than anyone else now? You've already admitted that you're distracted by this. Presumably the entire day pretty much has been taken up by it when you could have been doing your job more wholeheartedly. In your heart of hearts, do you think you can do this job as well or better than anyone else still?
Yes, I do. Can I also say that I didn't know about this until I was alerted to the story from the Scottish Sun last night. I, at that point, spoke to the Chief Medical Officer, who was back in Edinburgh by that point. So I absolutely, I'm 100% focused on the job I've got to do. And there is no dubiety about that whatsoever. I will continue to do that job to the best of my ability. Like everybody else, I'm in unprecedented times, and I will make mistakes along the way. And when I do, I'll be candid about that. But I tell people something absolutely clearly right now. I could not do my job as well as I am seeking to do my job without the continued advice and expertise that the Chief Medical Officer brings to this. And that is not in any way trying to diminish the seriousness of this. That is the wider point I am trying to ask people to understand. That advice comes on a whole range of issues, from understanding the spread of this virus to understanding the actions we need to continue to take to try to limit that spread. And that advice has been important for the last few weeks, and it remains important going forward. Lindsay Hannah from Bauer.
Minister, there will obviously be a lot of families and relatives have people in care homes today who are understandably extremely worried hearing about those who have sadly died at Burlington Court Care Home. How can you reassure these families that a tragedy like this will not be repeated?
Thank you for that important question. My heart breaks for the families of those who have died in the Burlington Care Home, and my heart breaks for the families of those who are in care homes across the country. That's never an easy situation for families to bear, and it's a particularly difficult situation right now. As I said in my statement, we are in close contact with Burlington through the Care Inspectorate, and we will continue to offer as much support as we can to the staff there and to residents who are in that care home and to their families. And of course, we are in touch with care homes across the country. Again, through the Care Inspectorate, we discuss these matters very carefully with the Care Inspectorate to make sure, firstly, that the right advice is being given to care homes, and also that they have the support, practical as well as the guidance support, that they need to deal with a very difficult situation. And that remains a key priority for us as we manage this epidemic. Paris Gutsianis from The Scotsman.
Thank you very much, First Minister. The UK Health Secretary, Matt Hancock, has suggested this morning that if people continue to flout the rules about not going out and not social distancing in parks and public places, that the right to exercise outdoors might be withdrawn. Would you support that measure? And do you accept, therefore, that your Chief Medical Officer has put at risk the mental health, the wider mental health and well-being of the whole population? And to the Chief Medical Officer, do you accept that as someone who fronts the public information campaign, you've undermined your own position, and therefore will you withdraw from these press conferences and also withdraw the television adverts that have been running even this morning with you telling people to stay at home?
On that last point, I will answer that, because these are our decisions for me and for the government. We will continue to carefully consider how we give public health advice to the public in order that that is as effective as we need it to be. Secondly, on Matt Hancock's comments, I have said all along that we will not hesitate to take steps that we think are required to slow down the spread of the virus, protect the health service and to save lives. And we continue to look very carefully at the actions and the steps that are required to take. But it remains the case right now that we are asking people, and I recognise both the difficulties in this today, but also the opportunity of underlining this message of why we're asking everybody, from the Chief Medical Officer and ourselves, right through the whole of Scottish society, to comply with the guidance that is already in place. The stay-at-home guidance, the guidance around social distancing if you require to be out of your home for essential purposes, and the guidance that I've reiterated today about what you should be doing if you are unwell, because as the virus continues to spread, unfortunately, more people are likely to have symptoms. So it's important in the wider message that we also don't lose sight of the very specific message for people who have symptoms. And that advice will continue to be given very strongly by the government in the most effective ways possible. Michael Blackley from the Daily Mail.
Hello, good afternoon. First Minister, do you believe that lives have been put at risk by the actions of the Chief Medical Officer? And do you agree with the Scottish Police Federation that their job has become a bit harder by what has happened yesterday?
Well, I think the Chief Medical Officer acted wrongly. She thinks she acted wrongly and has said that. As she said also, and I've repeated, I'm not saying this to take away from the fact that what she did was a mistake, but complied with social distancing guidance at all times. But nevertheless, she shouldn't have been there, and she recognises that, and I recognise that. In terms of the statement from the Scottish Police Federation, I think you heard the Chief Medical Officer herself say that she apologised to the police and to NHS colleagues for having made their job more difficult, and I would reiterate that. But, you know, I have an opportunity standing here today to use, not one I would have wanted to be in or have had to take, but nevertheless to use the fact that these rules, nobody, not the Chief Medical Officer or anybody, are exempt from these rules, to underline the importance of them. And that, I think, is the important opportunity for me to take. Christine Lavelle from The Sun.
Hi. The Scottish Government statement last night said the Chief Medical Officer had travelled to her second home to check on it while she had chance. I just wanted to ask, how does that square with you having travelled there twice now, we know, and does that mean that you lied to the government?
The Chief Medical Officer has been upfront with me about all of this, and you know that continues to be the case. What I'm saying, though, is that, of course, the Chief Medical Officer had her reasons for being there, but they're not important in the scheme of things, because those reasons do not justify the breach of the guidance. And that's the point I am seeking to make. We can all of us come up with reasons to do certain things that we shouldn't be doing right now, but they do not justify breaching the guidance. And I want to be emphatically clear about that. She shouldn't have been there this weekend or last weekend, and she knows that. She has apologised for that. My point as First Minister is not to diminish or get away from that, but simply to make the wider point. If I am to do my job effectively in steering the country through this to the best of my ability, which I am focused on literally every minute of the day and much of the night as well, I need to have her continued advice and expertise. She has been, along with me and the Health Secretary, immersed in this since the start of this outbreak, and I need her continued advice and support. The government needs it in order to make the right decisions to get the country through what is an unprecedented situation. Simon Johnson from The Telegraph.
Obviously, we're now in an unfortunate situation where we have a public information campaign asking people to stay at home, being led by somebody who's been given a police warning for not obeying that advice. I wondered, Chief Medical Officer, are you concerned that your continued presence in this role will cause more damage to that campaign and that people will stop listening? And secondly, did you offer your resignation to the First Minister this morning?
Look, the Chief Medical Officer has been absolutely clear with me that she wants to do whatever that may be, what is in the best interests of the country and taking the country through this pandemic. My judgment is that the best contribution she can make to that is to continue to give her advice to the government and to me as we steer our way through that. I'm going to answer the question of the public ad campaign because it's one for the government, not for the Chief Medical Officer to decide. Of course, we will continue to make sure that we are providing information to the public in a way that the public can have confidence in and is effective, because it is vitally important that we, however regrettable this situation is, we use it as an opportunity to say nobody is exempt from this guidance. It applies to everybody because the reasons for it are so vital. Tom Martin from The Express.
Good afternoon, First Minister. Just referring back to the question about the position that was said overnight in terms of the CMO was visiting her second home to check up on it. But now we're learning that there was a second visit. How can anyone out there have any trust or credibility in what we're being told?
The Chief Medical Officer has been full and frank in what she has said today. She has said it was a mistake. It was a mistake this weekend. It was a mistake last weekend. She is not shying away from that in any way, shape or form. We all make mistakes. She has made one in this instance. She will face and has faced justified criticism for it. She has been spoken to by the police, and it is important that she learns from this, as I believe she has and will, and that we all take the opportunity to reiterate the vital importance of the guidance that is in place. Alistair Grant from the Herald.
Hi there. Just to follow on from the questions of Christine and Tom, I think in the statement issued by the Chief Medical Officer this morning, she said, while there are reasons for what I did, they do not justify it, and they were not legitimate reasons to get out of my home. Is it possible just to ask the Chief Medical Officer directly, what were the reasons for going to your holiday home?
Chief Medical Officer.
I can't justify being away from my own home in Edinburgh. There are no reasons I could give you that would justify that. I want to bring back that I have made a mistake. I have let people down. I've let the public in Scotland down. I've let my NHS colleagues down, and I apologise unreservedly for that.
Kathleen Nutt from The National.
Hello, First Minister. I just really want to come back on the issue with the CMO. You said that she's made a mistake, that she's breached guidance, but also has she just acted unlawfully, and unlawfully twice? I think in the Coronavirus Act, it does state that people should stay at home unless there is an absolutely essential reason for going out. So has she acted unlawfully? And if so, how many times? And why then wasn't she fined if she's done it more than once?
Well, these are the issue of what action the police would take in any situation is not one for me. It's a matter of the police. The police are operationally independent. But, let me be clear, again, as I have been throughout, that nobody, not I, not the Chief Medical Officer, is seeking in any way to justify her actions. They were wrong, they were in breach of the guidance, and it shouldn't have happened. And, there is nothing that I will say or that she will say that will in any way detract from that. The wider point, though, is one about how we as a country steer our way through this. I value the advice and the expertise that she has given to me and to the government thus far, and it remains important at this crucial juncture as we fight this virus that continues to be available to the government. Mark McLaughlin from The Times.
Mixed messages. On the 10th of March, Jason Leach said, there's almost nothing to be gained at this point with stopping large gatherings or closing schools. You want to gradually increase the number of people infected over a very controlled period so that we get herd immunity. 2 days later, large gatherings of more than 500 were banned. Schools closed 9 days later, and yesterday the UK government's chief pandemic modeller said herd immunity might be part of the exit strategy. And again on Friday, he said there's no evidence behind media reports the virus will peak in a week. Today, Neil Ferguson, the UK government's forecaster, said the virus will peak in a week. So are we getting the same message from both governments, and are you getting the right message from your forecasters?
Look, I am trying to be candid with people about the advice I'm getting and what it enables me to say about the spread of the virus. And one of the things I've said consistently thus far is that there are questions I can't answer right now, because on the basis of what I have, which is up until now, although we're moving into a situation where this will be based on real data, the modelling doesn't allow me to be categoric about when we will see the peak of this virus. What I said on Friday, I would say again today. I have not seen anything in Scotland, based on the modelling that I've seen, that would suggest that this virus will peak in around a week's time. If I am proved to be wrong about that, nobody will be happier about that than me. But I am seeking to take decisions based on the best advice as I have it. We're in a rapidly changing situation. The advice takes account of how the virus is operating and the spread of that virus, and we have, as four governments across the last few weeks, adapted our approach to take account of that, and we will continue to do that. But it's important that that is based on the best possible information. None of us have faced a situation quite like this before, and it's important that we take judgments in good faith and that we base them as far as possible on the evidence we've got. But of course, that evidence is growing all the time as we substitute computer modelling for real life data. And so, as I said on Friday, I hope that in the days, weeks to come, I will be able to stand here and give a much more certain prediction of how long this will last and when we're likely to see this virus peak, but I am not able to do that right now. Sev Carell from The Guardian.
Good morning, First Minister and Chief Medical Officer. Thank you. Can I just go back to a question which I don't think we've had an entirely straight answer to? Did the Chief Medical Officer offer this morning to resign, or did she offer last night to resign? And secondly, the Scottish Government issued twice an official statement saying that she had been to her property to, quote, check on it. Why does the entire family need to go twice to check on a property that's only 45 miles away?
So in relation, to both of those points, the Chief Medical Officer has made clear to me that she would do whatever she is required to do, in my judgment, to be in the best interest of the country. It is my view that would not be her resignation, because that would deprive me and the government of the expertise and the advice that she is giving, because she is in a position of having been immersed in this from the start, and trying to bring somebody else in to do that right now would, in my view, not be the best thing for the government and for me as First Minister at that point. So that's my judgment. But let me be very clear. The Chief Medical Officer's only interest and only desire she has expressed to me is to do what I judge is to be in the best interest of the country overall. We are, and I say this again, we are in unprecedented times here. We will all get things wrong in this. She should not have got this wrong, and nobody is shying away from that. But I need to have the best possible expertise, and the government needs to have that if we are to steer the best course through this. And that's the position I'm making clear. On the other part of your question about why did a whole family need to go to do that, it is clear they didn't and they shouldn't. And that is the point. I am not seeking to justify this. I'm not seeking to say that there was any reason, and nor is the Chief Medical Officer seeking to say that there was any reason that could have justified this. So let me be clear again. It was the wrong thing to do. It was in breach of the guidance, and that guidance is there for all of us, and it must apply to all of us. So let me end, because Sev's was the last question that I had notified, by again thanking the public for sticking to this guidance. I know how hard it is, and I know we're asking you to make sacrifices, but please keep doing it for the good of the NHS and for the good of the country as a whole. Thank you all very much indeed.